Hello, welcome to our channel. Today we are talking about the early signs of pregnancy. What are the early signs of pregnancy? You are pregnant and you suspect that you could be pregnant, but what are these early signs to confirm that you are pregnant? Gerald Massa, the health educator, is the name of the channel. Remember to subscribe for new videos every day. So stay with me as we talk about the early signs of pregnancy after this message. Hello, welcome to our channel. I'm Gerald Massa, the health educator. On this channel we talk about pregnancy related questions. We answer all your pregnancy related questions. We also do talk about conditions including fertility, infertility, endometriosis, endometritis, and also we do discuss issues regarding polycystic ovarian syndrome. Let me know if you have any questions, and welcome for today's lesson. You are most welcome, and stay with me today as we talk about today's topic. Welcome. Thank you for waiting on, and thank you for listening to our message. So we are going straight away to our first sign of pregnancy, and the first sign of pregnancy we are going to talk about is what we call tender or swollen breasts. Tender or swollen breasts. In most cases, when we talk of tender or swollen breasts, specifically we are talking about your breasts becoming painful and also increasing in size. What causes the breasts to become painful and even increase in size? The first thing we need to understand is that the whole process of pregnancy is controlled and regulated by the hormones in a woman's body. So when we talk of the hormones, these are basically chemical-like substances controlling how the whole process is going to go on. So the key hormones we are talking about here include the HCG, or the human chorionic gonadotropin hormone, and then the estrogen hormone, and then also progesterone, and lastly prolactin. These four hormones, when they are actually increasing in size due to a woman getting pregnant, when these hormones increase in their levels, they increase in their levels, normally they tend to bring about the changes which basically include the tender or painful breasts and then also swollen breasts. So our first early warning sign of pregnancy is tender or swollen breasts. Let me know if you have any questions down below in the comments. Ask your questions and I will answer them right away. I'm called Gerald Massa, the health educator. That's the name of the channel, and we shall move on to our next sign of pregnancy. Our next sign of pregnancy is itchy nipples in early pregnancy. When a woman gets pregnant, the increasing size of the breasts brings about increase in the elasticity of the tissue, or the skin that is around the nipples tends to enlarge, and it tends actually to increase in size. So increase in this skin normally brings about itching. That kind of like increase in the size of the nipples specifically is the main reason why the nipples begin itching. So when the nipples begin itching, just know that due to their increasing size, the increase in the elasticity of the skin is the main thing that brings about the itchy nipples. So pregnancy sign number 2 is itchy nipples. Our first point was tender or swollen breasts. We shall move on to our next early pregnancy sign. Spotting or implantation bleeding. Spotting or implantation bleeding specifically occurs when a woman gets pregnant. The fertilized egg travels through the whole journey of the fallopian tube. Remember, fertilization takes place specifically most commonly in a part called the ampulla, that is kind of a junction of that fallopian tube. So when this fertilized egg travels the whole journey up to the uterine lining, also known as the endometrial lining, and it attaches itself on that wall, what happens is that there's what we call burrowing or digging. Imagine like you're digging into the soil. So when this fertilized egg is digging onto the uterine lining, there's rupture of blood vessels, also known as lacuna. So the rupture normally, or the burrowing of this fertilized egg, the attachment of this fertilized egg onto the uterine lining brings about release of some small drops of blood, also known as spotting. So this can also mean these signs we are talking about could also mean something else, but specifically today we are covering pregnancy. So whenever you see little drops of blood on your knicker, on that period when you are supposed to see your periods, maybe you go in your periods for 2 to 3 days, but you do not see your normal periods, but you get some little spots on your knicker, then that is a confirmation, or it could be one of the early signs to mean that you are, or you could be pregnant. We shall move to our next early warning sign. High basal body temperature. High basal body temperature specifically means your body temperature will increase when you are pregnant. Remember, the basal body temperature or your normal body temperature tends to rise. It tends to increase around day 14 of your cycle, meaning that is when you are most likely to get pregnant. On day 14, you count 3 days in front, 3 days back from your last normal menstruation date. That is specifically your ovulation period. So on day 14, the body temperature increases, but when you do not get pregnant on day 14 and you are nearing your periods, the temperature will go back to normal. But in a woman who has got pregnant or in a confirmed pregnancy, what happens is that the temperature does not come down. The temperature does not fall. It keeps rising. So when you get that temperature rising at the end of the month, you should not worry about maybe it could be a sickness. No, the first thing is wait. If at all you miss to see your periods, then you can always test. You can do the urine pregnancy test at home to remove all the worries. We shall move on to our next early pregnancy sign. Tiredness or feeling weak, feeling tired all the time. So our next early pregnancy sign is the feeling of tiredness. You feel weak all the time. Remember, this could also be a sign of your premenstrual periods, or it could be a premenstrual symptom like we talked about in our previous video. If you missed this, if you missed the lectures, then the lesson on premenstrual symptoms, you can go to our video library and the videos are all there. We've uploaded all the videos there. You can go and watch all our videos to learn more about premenstrual symptoms, the difference between premenstrual symptoms and of course like pregnancy. So the point we are talking about here is that when a woman has just got pregnant, there's increasing fatigue, there's increasing tiredness, and normally this is due to the increasing surge of hormones, the increasing levels of hormones that are circulating in a woman's body. So increasing tiredness or fatigue is one of the early pregnancy symptoms. Headaches, and actually a woman who has just got pregnant tends to experience lots of headache, and the main reason why the headaches tend to increase in a woman who has got pregnant is because the hormones estrogen and progesterone specifically tend to stimulate the neurotransmitters in the brain. Neurotransmitters are special parts of the brain that specifically tend to transmit messages in your brain. So the high levels of estrogen, the high levels of these pregnancy hormones simply are the estrogen and progesterone. We shall simply call them pregnancy hormones. So when a woman has just got pregnant and the pregnancy hormones are circulating in the body, they tend to stimulate the neurotransmitters, or they tend to stimulate those centers in the brain called neurotransmitters, bringing about headache. early pregnancy symptom, we are also talking about nausea. Nausea is one of the biggest early pregnancy symptom. The main reason why nausea is being talked about here is because when a woman gets pregnant, the hormones specifically known as the HCG hormone, the estrogen, progesterone, and luteinizing hormone tend to undergo lots of changes. The most important hormone we are looking at here is progesterone. It tends to be produced in high quantities. When a woman has got pregnant, the hormone progesterone is produced by the placenta. When she has just got pregnant and the placenta has not yet formed, the hormone progesterone is always produced by the corpus luteum. So when we have all these hormones surging, increasing, they bring about nausea. Nausea can be managed very easily by trying to actually go for bland dietary foods or go for foods that are not so oily. You could also eat more of crackers. Some ice cream will do. Some ice crystals, plain water ice crystals can help. And then also you could get some little ginger, put in hot water and take some. It can also help with the nausea. So pregnancy symptom we've talked about here is nausea in pregnancy. Frequent urination. When a woman gets pregnant, what happens is that there's lots of blood flow to the pelvic area. There's lots of blood flowing because there's something new happening in the uterus. So increased blood flow to the pelvic area puts more strain onto the whole urinary system, bringing about an increase in the urination or frequency of urination. But remember, this could also be a sign of infection. Always, if you are getting frequent, you are urinating frequently, contact your doctor so that some tests can be done. For example, the urine analysis test to confirm whether it is an infection or it could even be diabetes. So, but here we are talking about pregnancy. We shall stick to pregnancy. When a woman experiences lots of frequent urination, then this could be a pregnancy symptom. The other reason of a woman experiencing frequent urination is that when the uterus is gravid or when the baby is beginning to form in the uterus and growing, you will discover that the increase in the size of the womb puts pressure, or it actually presses onto the urinary bladder, and you discover that some little water taken, or when you consume some little water, when you drink some little water, what happens is that the urinary bladder, since it is being compressed on by the increasing size of your womb, there will be lots of urination. Backache. A woman who has just got pregnant normally experiences backache. The main reason is that the hormones we talked about in the beginning, that is estrogen and progesterone, tend to cause the ligaments to actually kind of like be very painful, and it's more of like a change in your body that normally cannot be this is a normal thing that happens. So backache can also be due to specifically the increasing size of the womb putting strain on your spinal cord or putting strain on your back bones. So you do not need to worry if you are experiencing backache. Just know that this could be pregnancy. You can always go have the pregnancy test done, but you could also talk to your doctor if the pregnancy test is negative and you are still experiencing the backache. It could be due to overworking, overstanding, or even carrying heavy things. We shall move to our next early pregnancy. Food cravings. When a woman begins craving for particular types of foods, for example, ice cream, and also maybe pickles or any particular type of food cravings, this could actually mean that you are pregnant. Always it's recommended that when you begin craving for certain rare types of foods, then it's very important that you confirm by having the urine pregnancy test being done. Thank you, and we shall move to our next. Food aversions. When a woman begins getting food aversions, a heightened sense of smell, an increased sense of smell to particular types of foods, then we can actually begin thinking of pregnancy. The most important thing we can do is the urine pregnancy test to remove any worries. Mood swings. Mood swings specifically are due to the hormones estrogen, progesterone, luteinizing hormone. When these hormones are increasing in their levels after pregnancy has taken place or after fertilization and implantation has taken place, these hormones normally change to bring about this mood. They tend to bring about these mood swings, but remember, as the pregnancy progresses, these mood swings can also reduce. So when you begin getting mood swings, previously you were a happy woman, but now you get turned off very easily, you get annoyed very easily, then consider having a urine pregnancy test or have a pregnancy test done to confirm this could be a pregnancy sign. Cramps. Cramps are really so common, but one thing that happens is that with cramps, normally when a woman has just got pregnant, when she has been confirmed that she is pregnant, the increasing size of the uterus, the uterine muscles or the muscles of your womb in preparation of receiving this fertilized egg, or the fertilized egg growing after attaching itself on the uterine womb or on your womb, normally the changes that are happening tend to bring about the crampy, or they tend to bring about the cramp pains. So it's very important when you are getting those cramps to go have the urine pregnancy test. Remember, it could be a pregnancy, or the cramps could be a sign of something else, like maybe premenstrual. It could be a premenstrual symptom, or a sign that you could be going into your periods, and maybe you may not be pregnant, but cramps are among the first early pregnancy signs. Acne or skin breakouts. Increase in a woman's hormones, pregnancy hormones after getting pregnant, tends to bring about acne and skin breakouts. Specifically, this is purely hormonal and you do not need to worry about it. If the skin breakouts are happening around your areola or around your face, consider using some safe moisturizers depending on where you live. You can always talk to your pharmacist or you can talk to your doctor, who will recommend moisturizers that are not dangerous or that will not bleach you. So talk to your doctor or your fertility expert to advise you on which moisturizers are the best to prevent the skin breakouts. But acne or skin breakouts are among the early signs of pregnancy. A missed period. Now, this is among the best and among the most recommended early pregnancy sign. When you are supposed to see your periods, like maybe today, but you miss seeing your periods and you go on, you take 1 week, you take 2 weeks, this is the best time to do the urine pregnancy test. Please do not rush to do the urine pregnancy test simply after you've missed your period. You may get a test that may confuse you. So a missed period is the most significant sign of early pregnancy, and remember to have the pregnancy test done 2 weeks after you've missed your periods. The main reason is that the pregnancy hormone, known as the HCG hormone, is always highest 1 week or 2 weeks after getting pregnant. Thanks a lot for passing by, for watching and learning from today's lesson. We were talking about early pregnancy signs, and this is a summary of the signs of early pregnancy. The first is tender or swollen breasts. Next, itchy nipples in early pregnancy, spotting or implantation bleeding, high basal body temperature, a feeling of tiredness or fatigue, headaches, you may get frequent headaches, nausea, feel like vomiting all the time, frequent urination, backache, the back pains a lot, food cravings, you crave for particular types of foods, food aversions, specifically this is like a heightened sense of smell to particular foods, mood swings. Mood swings specifically we are talking about you may feel low, you may feel high, you are happy today, tomorrow you're not happy, so that could be a sign of, it could be an early sign of pregnancy, and it's due to hormones. Cramps or pains, abdominal pains. Remember we talked about cramps, we said it is due to the increasing size of your womb. Acne or skin breakouts is also purely hormonal, and we've recommended that you could talk to your gynecologist or your doctor who will recommend some lotions. And lastly, we've talked about a missed period. A missed period meaning that fertilization and pregnancy has taken place, so ideally there will be no shedding of the endometrial lining, because we know that shedding of the endometrial lining is basically periods, or it is menses. So when you miss your periods, it is the biggest sign to confirm that you could be pregnant. And to go ahead and confirm, you need to do the 3 recommended tests. The first test is the urine pregnancy test, which has to be done early in the morning when the levels of the HCG hormone are high. You could also do the blood pregnancy test, which looks for the HCG or the pregnancy hormone in your blood. And lastly, you could do what we call an obstetric or pelvic ultrasound scan. This will be discussed with your doctor. They will recommend which test is best for you. I'm called Gerald Massa. I'm a health educator. The channel is called Gerald Massa, the health educator. Remember to subscribe to our channel so that you will be the first to get the videos I put out every day. I put out videos, I talk about pregnancy, I talk about women's health, I talk about women's diseases. This is the best pregnancy and women health channel on YouTube. And remember to subscribe, like, and hit the bell for notifications about the new videos we put out. And most importantly, ask me all your questions. I will answer all your questions. And please remember to check out all our other videos. Thank you for passing by. May God bless us all. Have yourself a fantastic and great day. Bye-bye. Hello, welcome to our channel. I'm Gerald Massa, the health educator. On this channel, we talk about pregnancy-related questions. We answer all your pregnancy-related questions. We also do talk about conditions including fertility, infertility, endometriosis, endometritis, and also we do discuss issues regarding polycystic ovarian syndrome. Let me know if you have any questions, and welcome for today's lesson. You are most welcome, and stay with me today as we talk about today's topic. Welcome.